Tobacco is one of the biggest public health concerns here in the United States. The most popular form of tobacco is smoking. Although smoking has gone down in recent years from 20.9% in 2005 to 15.5% in 2016, according to the CDC, nearly 38 million American adults still smoke cigarettes daily. Smoking is also very high in groups such as lower education levels, which is what we're going to be talking about today. Here in Fresno, there's a huge population of people who have low education levels, and it makes them more susceptible to smoke cigarettes. Data from the CDC and also studies we've researched have all concluded that the lower the education level, the more likely someone is to smoke than compared to someone who has a higher education level.
So to get a better understanding of this, we pulled data from the California Health Interview Survey, or the CHIS website, and we collected data from Fresno County. And so this data showed the percentage of smokers categorized by education level. So this pie chart shows all of the adult smokers in Fresno County categorized by education level. 4.7% of Fresno smokers have a PhD or equivalent. The same percentage is shown for smokers with a master's degree or equivalent. And 13.2% of smokers have a bachelor's degree, while 16.1% have some college education. The largest category of smokers, as shown on this pie chart, are those with only a high school level education at 24%. Using this data represents the smoking disparity between education levels. Those with a high school level education are more likely to be smokers as compared to those with a higher education level.
To collect data for this observational study, students from the epidemiology class at Fresno State walked around this campus and collected any form of tobacco products or tobacco-related substances. In our group, data collection was done at California State University, Fresno, Plant Operations. Plant operations is an area where the majority of the workers have at most a trade school level of education. The data collection was done during class time from 10 a.m. to 10:45 a.m. The temperature during the data collection was a sunny 85 degrees. Two members of the group were given a set of rubber non-latex gloves to collect tobacco products. Such substances could be identified as cigarettes, lighters, cigarette packs, chewing tobacco cartridges. However, the data collection primarily consisted of cigarette butts. The other members of the group helped with searching for tobacco products. In addition, they carried bags for collecting tobacco products. They also carried their mobile cellular devices to capture photos of no smoking signs, ashtrays, or people smoking.
Across every dimension of health, those with more education experience better lives, healthy lifestyles, and live better. Differences in cigarette smoking and education represents one of the deadliest of such inequalities. Smoking, however, takes its toll on individuals with less education. Plant operations was our study area. Plant operations is located between Science 1 and Engineering West building on the Fresno State campus. The observation study was done September 6, 2018, immediately following the opening home game, estimating the tobacco prevalence with the community. Based on the results within the plant operations area, there were 192 cigarette-related trash items found. Types including such as cigarette butts, cigarette boxes, and chewing tobacco. In previous data from 2017, there were no related results to compare with within the area. Plant operations does have one of the highest collected results on campus while having no smoking signs and the no smoking policy fully enforced.
What our findings indicated is that there is a correlation between education levels and smoking rates. On campus, where we collected cigarette butts and other smoking materials were in an area that was mainly faculty occupied and also had faculty with lower levels of education. A way to stop the faculty from smoking on campus is to provide them with more education on the health-related risk as well as to the students. We think that if the school was able to do this, it would eliminate smoking on campus and the risk of secondhand smoke altogether. And this corresponds with our findings through the CHIS observational studies as well.
We noticed here on campus that even though there is a smoke-free, tobacco-free, and vapor-free policy, it is not publicized as much as it should be. However, Fresno State's smoke-free webpage, located on the Fresno State website, includes a tab designated to smoking cessation programs offered for both students and faculty. The Student Health Center offers a free Quit Kit that includes a 20-piece box of nicotine gum and a list of cessation programs in the area. The Clear the Air policy at Fresno State aims to eliminate smoking of any kind here on campus to provide a safe and healthy environment for its students.